In the heart of Bengaluru, amid the hustle and bustle of urban life, a remarkable story began to unfold. This is the inspirational story of how Nightingales Medical Trust came into existence. A story with two committed individuals at its core, Dr. Radha S. Murthy and Mr. S. Premkumar Raja. Our story begins in the late 90s when Dr. Radha and Mr. Raja worked together at a prominent hospital in Bangalore. They witnessed the challenges faced by the elderly in accessing healthcare services. They saw the struggles of going to a hospital alone, having to run around for tests and medications, and the burdens of commuting long distances in a metropolitan like Bangalore. These individuals shared a vision of a brighter future for the elderly. They dreamed of a society where seniors could age with grace, dignity, and access to the care they rightfully deserve. Their dream was to create a program where medical care, nursing care, medical tests, and medicines could all be made available at the homes of the elderly.
Many elders used to approach us to have medical services at their homes. The reason being that there were traffic woes, also difficulty in going to the hospitals, children were not around. And seeing this, we started the Nightingales Home Health Services.
The Nightingales Home Health Services was born in 1996. Under this program, a panel of doctors were available round the clock to visit the homes of the elderly. Nurses were on standby for procedures and dressings, and agreements were made with pharmacies and labs for blood tests and supply of medicines. Although a new concept with very few takers initially, the community soon realized the value of this venture. And soon more and more people depended on the Nightingales team for their own medical needs and for their loved ones. Nightingales Home Health Services became a beacon of hope for countless elderly individuals and their families. It transformed lives, offering medical care in the safety and comfort of their own homes. Over the days and months, Dr. Radha and Mr. Raja realized that medical care was not the only need. Elderly would call them yearning just to have a companion to talk to. Loneliness was real. With the changing lifestyles and break in the traditional family systems, more and more seniors were left to fend for themselves with no social life.
Now the senior citizens were not looking only at health issues. Many times I've gone there where they did not have only health issues, but they just needed some sort of a counseling. And I noticed that there were a lot of loneliness. There was also elder abuse, and also I could pick up a few cases of dementia. And this led us to start Nightingales Medical Trust.
Elder abuse was another distressing and increasingly prevalent issue that was observed among the elderly. Often in the shadows and unnoticed by society, elders were abused by the ones they trusted, their own family, carers, and service providers. Another pressing issue among the elderly in India was financial insecurity. Due to various factors including inadequate social security systems, lack of pension coverage, rising healthcare costs, and the shifting dynamics of family structures, many seniors struggle to make ends meet during their retirement years. The absence of comprehensive, affordable healthcare systems further exacerbates their financial woes. Medical expenses can quickly deplete their small savings. Many promoted old age homes as the answer to these problems, but Mr. Raja and Dr. Radha did not agree. They realized that old age homes can increase the feelings of isolation, loneliness, and emotional distress among the elderly, leading to a sense of abandonment. Furthermore, the quality of care in old age homes can leave residents without the level of personal attention and support they require. There was a void to better address the needs and well-being of the elderly, allowing them to age with dignity in a familiar and supportive environment.
As per the recent United Nations reports, in India, we have about 15 crore senior citizens. It's projected that by 2050, the number will touch 35 crores. This is going to pose serious challenges, not only to senior citizens, but also to the families, the society, and even the country. Senior citizens have various problems. The problems are quite complex. Broadly, we could divide the problems into social, emotional, physical, and financial. To help elders in a holistic way, Nightingales Medical Trust was established, and through various need-based and innovative programs, we have been striving to improve the quality of life of elders in our country.
Nightingales Medical Trust was conceptualized, planned and registered as a not-for-profit voluntary organization in 1998. Its first project was the Nightingales Elders Enrichment Center, planned to mitigate loneliness among the elderly. Over the years, other pressing needs have been identified and innovative programs have been drawn up. Elders Helpline to tackle elder abuse, Job 60 Plus program to empower the elderly, active aging programs, dementia care programs, training, awareness and advocacy programs, homes for destitute elderly, rural Medicare, daycare centers for urban poor, and rural care centers, just to name a few. The genesis of Nightingales Medical Trust is a testament to the power of compassion and the difference a dedicated group of individuals can make in the lives of the elderly. Today, the trust stands as a symbol of compassion, hope, and resilience. Nightingales Medical Trust, where every day is an opportunity to make a difference in the lives of those who've given us so much.